We're going to go through the 6 types of synovial joint shapes that determine the movements that can occur. So we're going to start with the simplest and move to the most complex. The first is the planar joint or plane joint, and it allows non-axial movement. So sort of a gliding movement is allowed. And it's all due to the design of the bone. So as long as you can think of the shapes of the parts of the bones that actually articulate, you can kind of figure out the rest of it. So these happen at the intercarpal joints, the intertarsal joints, and joints between the vertebral articular surfaces. So we would see them between these carpals. So if we were to zoom in and you looked really closely at the carpals, there's very, very little movement or little space between the carpals. So when they move slightly, it doesn't even allow for movement in one plane. So that's why it's non-axial. The next 2 that we're going to talk about are uniaxial, the first of which is the hinge joint. It works just like the hinge of a door, and it is uniaxial movement. So it's in the elbow joints and interphalangeal joints. These are just 2 examples. There's other modified hinges throughout the body, but where we see the humerus and the ulna is a great example. And it's due to, again, the shapes of the articulating bones. So it looks like there's a cylinder that sits in a trough, and it allows for flexion and extension. So when that biceps brachii is going to flex, it's going to decrease the angle between the bones at the elbow joint. And when it extends with the triceps, it does just the opposite. The next one is the pivot joint, also is uniaxial. And there's an example of it just a little distal to the elbow joint where the hinge joint is. This is just because the radial tuberosity is going to articulate with the ulna so that we can either medially rotate or laterally rotate. So there's an axle, which is the rounded body like the radial tuberosity, that articulates in a sleeve, the bone or ligament, to allow rotation. So examples of this are the proximal radioulnar joint and the atlantoaxial joint between C1 and C2. The next example would be the biaxial joints. So again, we've gone through the non-axial. So there's one non-axial, 2 uniaxials, and now we're going to have 2 biaxials, which are shown here. So I'm going to enlarge it just so we can see those 2. The first one is called a condylar joint. And a condylar joint involves oval articular surfaces. It happens at the knuckles and also between the metacarpals and the distal carpals. So the metacarpophalangeal knuckle and the wrist joint. And it's only at these joints here. It's not at the intercarpal joints here because we know that that's a non-axial or gliding joint. So the type of movement is biaxial. So and biaxial means there's 2 planes. So if it's only flexion extension, it's considered uniaxial. But if it's both flexion extension and abduction adduction, then it's a biaxial joint. The second example of the biaxial joint is what's called a saddle joint. And the example here is called the carpo-metacarpal joint of the thumb. And for lecture, as you know, it's all multiple choice, a few true and false, but you just would have to recognize that term. So as long as you realize it's the carpals interacting with the metacarpal of the thumb, you would be fine. And it's at this specific example here where it's the thumb, We know it's the thumb because there's only a distal phalanx and a proximal phalanx. There's no middle phalanx. And the reason it's called a saddle joint because it literally looks like a saddle sitting on top of a horse. One's concave and one's convex. So again, it allows movement in two planes, flexion extension and abduction adduction to make it multi-axial. And then finally, we have the multi-axial joints, and there's only two of them. They're ball and socket joints. We know one is the shoulder and one is the hip. And it's all due to the articulating surfaces. So there's a cup or a socket, and a spherical head is going to fit into that. So the head of the humerus, which is this rounded part right here, is going to fit into this shallow depression, which, as you know now, is called the glenoid cavity or glenoid fossa. In the hip, it's because the head of the femur fits into the acetabulum. So again, with multi-axial, it allows all movements. It allows flexion, extension, abduction, adduction, rotation, and circumduction. So if they were to ask you, like for example, on a lab, what type of movements are allowed at a multi-axial joint, you would answer all four of these. You would say flexion, extension, abduction, adduction, rotation, as well as circumduction. So the next part of the lecture slides are looking at some selected synovial joints. And these joints, synovial joints, are very, very diverse. Some have more ligaments, some have less. Some are the design of the articulating parts of the joints are, a little bit different as well. So we're going to look at the jaw, which is the TMJ joint, the temporomandibular joint, shoulder, elbow, hip, as well as knee. For the temporomandibular joint, the TMJ joint, a lot of people have problems with the TMJ joint. It's a modified hinge joint. And since it's hinge joint, you should all know that means it moves in one plane, which makes it uniaxial. So as I've mentioned before, the mandibular condyle articulates with the mandibular fossa for that type of movement, which is depression and elevation of the mandible. Also some side-to-side grinding of the teeth. So if people wear an occlusal guard at night, a lot of times that's to prevent the grinding of the teeth that happens at night. So if we zoom in here and look a little more closely, we can see the mandibular fossa in the temporal bone. And we can't see the mandibular condyle just because it is covered up by the articular capsule and some of these supporting ligaments. So when we look at the other images here, you can see it a little more closely as well. We see the condylar process of the mandible, which is also the same thing as the mandibular condyle, so you can say it either way. You can see a lot of the supporting structures of the synovial joint are here, like the synovial membranes, articular capsules, articular disc as well, and then some supporting ligaments that we saw on the other slide. The next one is the shoulder joint, which is the glenohumeral joint, and it allows for much freer movement. It is, remember, after all, it moves in multiple axes, so we call it multi-axial. And remember, the stability is sacrificed for freedom of movement. So there's less stability, but more range of motion, which I'm going to put as ROM. So the ball inside has this large hemispherical head of the humerus that fits into a small, shallow glenoid fossa. We can see all the supporting structures here. We see a coracoacromial ligament. You don't have to name specific ligaments or bursa, but the bursa, those are the basically sacs of synovial fluid, just like a tendon sheath is. We have a synovial membrane, articular cartilage, synovial cavity. So all the major hallmarks that we would expect of a synovial joint. In this example, we have our tendon sheath. We have ligaments here, tendons, bursa, more ligaments, another bursa, and we can't quite see the articulating structures just because of all the supporting structures that are found surrounding it.